It's my feel-good breakfast show.
Welcome back. It is your Feel Good Breakfast Show, Expresso, here on S3. It's a Tuesday morning. That means we are talking health. And now, South Africa is preparing for phase 2 of the vaccine rollout plan, which will see persons over 60, persons over 18 with comorbidities, and essential workers get vaccinated. Now, over 288,000 South Africans have already received the Covid-19 vaccine as the number continues to rise. An infectious diseases specialist, Dr. Emile Reid, is back from holiday, looking radiant, and is giving us a coronavirus vaccine update. Of course, we invite you to get in touch with us on 021 110 552 if you've got any questions for the good Dr. Reid. Dr. Reid,
morning,
got a glow back with you. It's so good to have you back.
Exactly. Yeah, so good to be back.
Looking well rested.
I am. Thank you very, very much.
Glowing after that holiday. Well, Doc, let's get straight into it. Of course, I'm sure South Africa is dying to know, what are the numbers looking like at the moment? I mean, how are the infections going?
Well, guys, things are looking very, very good. Okay. We're currently sitting around about 20,000 active cases. And remember, not too long ago, we were in a similar position, round about end of September, October last year. Yeah. So we have this absolute lull about COVID-19, but people should not forget it's the invisible enemy. And we need to continue with our mitigation strategies, the way we've been doing. And I know people are becoming COVID fatigue. They don't want to wear their mask. They want to go and wine and dine with their friends. But now is not the time to actually do it.
We have to be extra cautious, especially right now, if we're going to try and pause or delay anything of that nature.
Exactly.
But we know that the vaccine has already arrived in its first phase in South Africa. We've spoken about this and reported on it, that the healthcare workers and those in the front line in that sense have received it. Do you have an update on that? Who exactly has received it and who's in line to get it next?
Well, if one look at the phase 1 of the vaccine rollout, the so-called implementation phase or the implementation study, it's not a trial, so nobody is getting placebo, everybody's getting the active vaccine. And currently about, as you said earlier, 288,000 healthcare workers have been vaccinated. And we're aiming during the first phase to vaccinate around about 1.3 million healthcare providers. So we still have a far way to go. And the important thing is to remember that we need to get to something called herd immunity, meaning that between 70 and 85% of everybody should either get immunity due to contracting the disease or they should be vaccinated. And currently in South Africa, we're sitting around about 0.5% of the population that have been inoculated. So we still have a far way to go in order to...
ocean, really.
Exactly. Yeah. So currently the only people that are truly protected are those healthcare providers which already received the jab in their arm.
Wow, Doc. So it looks like the numbers definitely need to climb. But, I mean, let's talk about the fact that if we were to get vaccinated, would it mean that we would need to get another vaccination if a new strain came through within the same year of us having gotten the vaccination initially?
Well, that's going to depend on what happens to the virus. And as I said before, the more we allow this virus to replicate, we can expect more variants to develop. And currently, we sat with a variant in South Africa that actually annihilated our healthcare system towards the end of last year and the beginning of this year. Britain is sitting with a variant there. Brazil is sitting with the third version of the variant, which is more transmissible, and it's actually causing havoc in those countries. So if we look at the Northern Hemisphere currently, just in the last week, there were more than 4 million new cases of coronavirus infection that was diagnosed worldwide. So really we are on an upward trajectory. And currently in South Africa, if we took note of what happened last year, we probably expect the same to be happening.
Staggering. 4 million, that is a lot of people contracting the coronavirus. And of course it sounds, and we all know surely by now, that it's such an unpredictable virus. But of course, this conversation with Dr. Emile Reid continues here on your Feel Good Breakfast Show with your questions. We take them, we welcome them on 021 110 5552. We'll find out all about this next phase of vaccinations that's coming through and how that system is going to work, how all of you at home and us here are going to be able to register for that and be a part of it. Right now, we take it to the kitchen for some kitchen inspiration.
It's my Feel Good Breakfast Show.
Welcome back, everybody. Thank you so much for opening up with S3 this morning on your Tuesday. Of course, we are continuing with our health discussion this morning. Infectious Diseases Specialist Dr. Emile Reid is still with us and is ready to answer all of your burning questions on the coronavirus vaccine. Again, thank you so much to everyone who has sent through your questions and all the callers that is coming through this morning to get in on this topic.
Indeed. So 021 110 5552. Thank you very much. And the good doctor is ready to answer your questions. And I'm glad that you're asking. You ask more questions, you get more answers, and you get credible information from sources, unlike social media, from a doctor like this. So we got our first caller. Lehai, welcome.
Hi there, how are you?
Feel free, the doctor's listening to you. What do you have to ask?
All right, doctor, I just wanted to ask a question. There hasn't been much discussion about the side effects. And I wanted to know if someone has got epilepsy and they have a vaccination, is that dangerous for them? Can that bring about seizure or anything like that?
And that's a fantastic question. Thank you very, very much for that. The answer to that is no. There's no interaction between your anti-epileptic medication and the vaccine. And also there's absolutely no current data to suggest that the vaccine can actually cause recurrence or an exacerbation of your epilepsy. So you don't have to worry about that.
All right. Thank you very much, doctor.
Great, man.
Looks like we have another caller in. We have Ella from Cape Town. What is your question for the good doctor?
Hi, good morning, doctor.
Morning, Ella.
Family.
Good morning.
It's my Ola speaking. I would just like to know, I'm a person over 60, no comorbidities, and I would just like to know, why must I get the vaccine if it's all over social media that it does not prevent you from contracting the virus?
Okay. The most important thing is to remember that no vaccine is perfect. So no vaccine can protect you 100% from contracting COVID disease. And the most important thing of these vaccines that we have, especially with you being above the age of 60 years, is to remember that you are, number one, high risk, even though you don't have any comorbidities. And the important thing is, when it comes to vaccination, the main aim is to protect you from developing complicated COVID-19 or end up in a hospital being treated in high care or in intensive care unit. So what these vaccines do, you can still contract COVID-19 illness. You can still probably transmit it to your friends and family, but your virus load is extremely low. So the likelihood of that happening is very, very low. But the important thing is you will not become sick of COVID-19.
Thank you so much, Myla from Cape Town, for your question. I believe we have another caller, Charles, as well, on the line. What is your question for the doctor? Charles, are you with us? Morning, Charles.
Morning, how are you?
Good, and you? I believe you're calling all the way from Johannesburg. What is your question this morning?
I wanted to find out, is there any type of thing that they can give besides the vaccine, like a fruit or something that could give the body oxygen? My mother passed away of COVID, and she had 3% oxygen in her body. And You know, must be some sort of fruit or food that can actually add oxygen to the system to help along there. Is there something like that that the doctors have had a look at?
Charles?
I've heard and I've been reading about the pomegranates. The pomegranates can also help the system. I'm not too sure. I'm not a doctor, but it's just hearsay, you know?
Yeah. Charles, please accept our condolences with the passing of your mom. We're sorry that happened to you. With regards to your question, there's a whole host of fruit and food that can actually assist us with regards to boosting our immune system. Vitamin C, extremely important, so oranges, etc. The other important vitamin, vitamin D, which we have plenty of here in the Western Cape, being outside, being in the sun, etc. And vitamin D also play an important role with regards to your bones, your skin integrity, as well as prevention of tuberculosis. Then we have zinc, vitamin B, and all these other nutritional advances available. And unfortunately, there is none of the fruits or minerals or vitamins that can assist with boosting your oxygen level in your blood. So prevention is better than cure.
Thanks a lot, Charles, for your question, and a massive thank you to you, Dr. Emile Reid, for all of the information, the credible information, the stuff that you don't hear in social media. This is the stuff that you actually need to listen to right here. So no matter what, as long as you stay safe, stay as healthy as you can, keep your distance, wear your mask, sanitize, do the necessary, and ensure that you do listen to the credible source of information and don't spread fake news. That's exactly what I'm saying right now. When I say fake news, here's some credible news right here on S3. And our Tabiso, Uncle Tabzi, is standing by.